Conditions affecting the pancreas vary from inflammatory type conditions to more serious cancers. And as a pancreatic specialist, I treat the entire spectrum. So if we look at the inflammatory conditions first, these are things like pancreatitis, which is a strange illness because it can vary from a more mild illness to a very severe illness. The commonest causes of pancreatitis are things like gallstones, especially in women, and alcohol, which, as we are aware, is a problem throughout the United Kingdom. There are rarer causes of pancreatitis. For example, some drugs can cause this problem, like steroids. And why it's a strange illness is it can vary from a mild illness where people need hospitalization for a short period of time, usually for a bit of pain and sometimes for vomiting, and then they get better quickly, to a more serious illness, which for some reason cascades into a multi-organ failure picture, where patients require very intensive treatment on an intensive care unit. And this can actually lead to necrosis and death of the pancreatic tissue. And if that gets infected secondarily, then you can have a very severe problem that I'm afraid in rare conditions can be life-threatening. So as you can see, varying from a mild condition to a more severe condition, and sometimes we don't really understand why that is. But obviously it's something when someone presents with pancreatitis, we have to keep a very close eye to see which way it's going to behave. And then we obviously treat other conditions like sadly cancer of the pancreas, which obviously is a devastating illness in a lot of patients. And sadly, not all patients are amenable to surgery, but the cancers can vary as well. So the most typical type of cancer that people would be aware of is something called adenocarcinoma, which is the more typical type of pancreatic cancer, and is an aggressive cancer and is difficult to treat because often by the time the patient presents with the cancer, it has spread to other areas of the body, and then the treatment is not a surgical treatment. The treatment is normally a systemic treatment, which we can discuss. But there are also less aggressive types of cancer of the pancreas, and those are, for example, neuroendocrine tumours, which are rarer tumours, but I'm pleased to say often behave in a less aggressive way, and therefore are more amenable to different types of treatment. Unfortunately, a lot of the time when people present with pancreatic cancer, we don't really know why they developed the cancer, and it's something like a sporadic cancer, and it has just appeared but from no fault of anybody. And it's patients, of course, always want to know why, and sometimes we can't give them that answer. Smoking has been linked to pancreatic cancer, as it's been linked to many different types of cancer, more commonly lung, but it probably does predispose to pancreatic cancer. Obesity and chronic inflammation of the pancreas. So someone who has had pancreatitis that has developed into a more chronic condition, a chronic relapsing condition, where the repeated inflammatory episodes are said to somehow trigger the development of cancer. And then there are rarer genetic forms, which we are beginning to learn more and more about. And we may find that more patients in whom we don't really understand the cause, they just simply have a genetic predisposition. But actually, when you look at families that have a very high incidence of pancreatic cancer, they are very rare. And I'm pleased to say that it usually isn't a strong genetic component as far as we understand. Well, obviously, as a surgeon, I would love to be able to say that I can treat everyone with pancreatic cancer and remove the cancer, but that's not always the case. Sadly, often when people present with pancreatic cancer, it is a cancer that has affected other areas of the body. In other words, it's spread from the pancreas, perhaps to the liver or to the lungs. And in that situation, unfortunately, removing the primary cancer does not affect the outcome. So I would be handing those patients over to oncologists. They would be giving systemic treatment with chemotherapy or potentially ablation or radiotherapy. But when a cancer is localized in the pancreas, we're often able to treat it surgically, and sometimes that's removing different areas of the pancreas. It can be removing the head of the pancreas, or it can be removing the body or the tail of the pancreas on the other side. Now, obviously, those are big operations, but if you can take the cancer out, then that often can offer the patient the best possible prognosis. Sometimes we actually are giving patients systemic treatment prior to surgery. In other words, we're giving downstaging treatments with chemotherapy or with radiotherapy before we operate on them. And that's especially when the cancer is a more advanced cancer locally. In other words, it's involving other structures close to the pancreas, like blood vessels. And we're trying to both control the spread of that cancer and also trying to shrink that cancer so that when we do the operation and we remove the cancer, we are able to remove all the cancer tissue and leave no cancer behind. And then that offers the patient the best possible outcome in the long term. Well, as I've said at the very beginning, there is a huge spectrum of conditions that can affect the pancreas, and they do vary from very mild conditions to more chronic and then life-threatening conditions. So, for example, if we take somebody with a mild attack of acute pancreatitis due to gallstones, if they make a full recovery from the pancreatitis and we're able to remove their gallbladder and prevent recurrences of the pancreatitis, then that can be a curative treatment, and those people can have no problem with their pancreas in the future. But if we take another cause of pancreatitis like alcohol, and unfortunately somebody keeps drinking, then they can get regular flare-ups of pancreatitis, and that can damage the organ, and that can lead to it can damage the functions of the pancreas. It can lead to diabetes, and it can lead to exocrine insufficiency, which is problems with digestion of food, and then that can have very long-term ongoing chronic problems in patients like chronic pain, which can actually be very, very difficult to treat. And sometimes these patients' quality of life can be really affected. So again, we really encourage people, if they have an attack of a pancreatitis due to alcohol, that they have complete cessation of alcohol and try to prevent further attacks. And in terms of cancer, we've talked already about different treatment options, about us learning more about the treatment for pancreatic cancer. But I'm sad to say that in the most common type of pancreatic cancer, even with successful surgery, usually those people's lives will be shortened by the disease, and the cancer at some stage will come back. We're understanding more about the genetic makeup of the cancers and how they behave, and we're beginning to try to target the treatment options like the types of chemotherapy or the immunotherapy to be able to specifically target the abnormal cancer cells and hopefully prevent the risk of, or reduce the risk of the cancer coming back in the future. And there are some cancers like the neuroendocrine tumors that I mentioned earlier that people can live with for very many years, and both surgery and drug treatments for those cancers can give people very good quality of life and a good prognosis. So as you can see, it's a difficult question to answer because there is a huge spectrum of different outcomes for different conditions.